Hello everyone, this is the Plastic Surgery Guru, and today we will be talking about wound healing in less than 3 minutes. So, wound healing has 3 steps. Basically, we have the inflammatory phase that takes about a week, the fibroproliferative phase, which takes about 2 weeks from day 4 to week 3, and the maturation phase, which takes about a year. So, we have a wound that is open and bleeding. What will happen first? There will be the inflammatory process to close this wound, the bleeding wound. So basically, we have vessels that will vasoconstrict, and then the coagulation factors are activated to close this wound. And also, we then have the vasodilation to allow via chemotaxis, allow the WBCs to reach the wound site and stop any infection or possible infection. And this happens via margination and chemotaxis. And we have the cellular response is basically 3 cells, which are mainly the neutrophils, macrophages, and lymphocytes. And the macrophages are the most important in this phase. Next, the wound is basically not bleeding right now and not infected and not inflamed, or the inflammatory process stopped. We have the next phase, which is basically to close this wound, this open wound. What will happen is that we have to have cells that will close it. This matrix is created by the fibroblasts, which have the key day in the fibroblastic proliferation is day 7, usually the 7th day from the wound that was caused. And then we have the glycosaminoglycan, which are also elements of the wound matrix, and these are basically the collagen, and which is collagen type 4, hyaluronic acid, and the sulfate family. And also we have new blood vessels that will be created via angiogenesis, and these new blood vessels are from old blood vessels. And lastly, we have the epithelialization, which are basically 4 steps that will create the floor of the wound. These 4 steps are basically mobilization, migration, mitosis, and differentiation. Mobilization is basically the edges of the wound are still have epithelial cells, and these cells will mobilize to and migrate to mobilize and adhere from the edge and migrate to places where there are no cells, and basically these will proliferate via mitosis and differentiate to the necessary cell that is in need in this specific site of the wound, ranging from the basal layer to the stratum corneum. Last but not least, we have the maturation process, which, as I mentioned, takes about a year. This is when the collagen breakdown and the collagen synthesis are equal, and the most abundant type of collagen will be type 1, which is the same as the rest of the body, with the ratio of 4:1 to type 4. Lastly, we have contractions, which are an important aspect of wound healing. Basically, when the dermal layer is minimal, more contractions will happen, and contractions are basically myofibroblasts. Thank you for listening.